Well, more than 5,400 people have died in the latest outbreak, with Guinea, Sierra Leone and Liberia the worst hit, and the death toll is rising. The World Health Organization is continuing to coordinate efforts to contain the outbreak in those nations, and now there are fresh hopes of a vaccine. Tarik Jasarevic from the WHO joins us now from Geneva. Mr. Jasarevic, thanks very much for joining us. Firstly, human trials of an experimental Ebola vaccine suggest it's safe and may help the immune system combat the virus. Are you excited about this development?
Well, definitely we are very encouraged by these reports that are coming out, but we have to remember this is only preliminary data that are coming out of one of two vaccines that we are currently putting on trials. We have to really wait for more results for this vaccine that is being tested not only in the US but also in Mali and Switzerland, but also another candidate vaccine that's being tested in the US, in Switzerland and Gabon. Only when we get all results from those trials for both vaccines that would prove that each vaccine is safe, but also that is producing antibodies in a body of those who are volunteering to do this testing, then we can move to phase 2. And only after phase 2 we can really say that this is something that we want to use on a larger scale.
Do you have any idea of what sort of a time frame we're talking about here?
Well, we are looking really to start a second phase in January in neighboring countries to those affected by Ebola virus. And just to remind your viewers, so phase 1 is really to prove that vaccine is safe and that we can determine the correct dosage of vaccine that is producing antibodies. And then in a phase 2, on a larger number of people, we are trying to show that these antibodies are right ones and are protecting really the people. In a phase 3, we are then already deploying the vaccine, and we vaccinate those who are identified as a vulnerable population. Notably, it would be health workers in this case. But again, we are really at the beginning. We hope that these promising results will continue this way, and that this parallel work on vaccines will complement the work that we are already doing on the ground to contain the outbreak.
As I mentioned, Australia is sending its first team of health workers to Sierra Leone after initially refusing to send help. How do you feel about Australia's commitment to the Ebola effort?
Well, we are working with all our member states, and we were keeping calls to all those who can help, who can provide, especially health workers, to go to affected countries, to build as many treatment centers as we can. So we really try to have every sick person being out of their homes, being out of their communities, receiving supportive care and stopping to infect others. And this was what we are really seeing right now, that if we have enough of treatment centers, if we have enough of beds, if we continue to train and equip enough of teams that can do safe burials, we can have some positive results. So every contribution is welcome, and we hope really that we can match all these teams coming from different countries with existing health facilities so they can start to work as fast as possible and try to alleviate really the burden of disease right now in those countries.
We're also hearing tonight that French President Francois Hollande will become the first Western leader to visit an Ebola-hit country. He'll be visiting Guinea. But what's the situation at the moment in the worst hit countries? What's needed now to really tackle the disease?
Well, we need to continue to do what we are doing so far. So as I was saying, to try to have as many capacities as possible to receive all those who are infected, to provide them with necessary supportive medical care that increases the chances of survival. We need to have also trained and equipped medical teams to work in those centers, and that's why we are appealing to member states and other organizations to come forward with the medical teams. We need teams that would do safe burials. We know that a big number of infection is occurring through burial ceremonies, and that's why we need to make sure that those who die from Ebola are buried in a dignified yet safe way. We also need to have enough of laboratories so we can test everyone who is a suspect of having the disease. We also need to work with communities. The community participation is the key. What we are seeing right now is that the the number of new cases is not rising exponentially as it was case a couple of months ago, but we still see new cases. We still know that there are people out there who are not reported, who are infecting other people, but we also notice when we have all ingredients in place, when we have all those measures that I was just mentioning in place, we can slow down the virus, and we can at some places right now, instead of being behind the virus, go ahead of it and hunt the virus through active case finding and contact tracing.
Okay, Tarek Jasarevic, we'll have to leave it there, but thank you again for your time.
Thank you.